My name's Dr. Richard Westreich. I'm a facial plastic, nasal, and reconstructive surgeon, and I work in New York City. I think it's important to spend time with people, make sure that they are able to communicate their thoughts and that you understand what it is they're trying to accomplish. It's also important to spend time with people to educate them and tell them about why you're making certain choices or making certain recommendations, and all that stuff takes time. So, I spend the majority of the time with the patient. There's not somebody else in my office that you're going to see coming in, more than you see me. You're going to see me for most of the time, and there's hopefully going to be really good communication, and everybody's going to have an opportunity to, get into the conversation. And I think that is relatively unique. It's not something that happens in all offices. More importantly, I think what happens from that communication is that everybody gets their own personalized care. Everyone gets their own individual outcome. Because for me, I think it equates into more natural results. If you do the same thing in every person, it's not going to look right on everybody. So, it's really easy to make things look different and look unnatural. It's really challenging to make things look different but look natural. I don't want anyone to walk out of the office and have other people that they don't know, recognize that they had something done. I don't want there to be a Westreich nose or a Westreich look. I want the patients to have an anonymity with that. That people only know they had stuff done with me if my patients want to tell other people they had stuff done with me. And that's really the goal of the whole process here. And I think the way you have to go about it is spending time and communicating. And that's what the office is kind of structured for. So I think that's unique. I think the outcomes are unique. I think that patients recognize that, and that's why they walk out of here happy. A lot of people think plastic surgery is about vanity, whereas most patients come in and they have something that bothers them. It's a barrier. They just want it solved, and we're able to do that for them. And when you do that enough from the doctor's perspective, you realize that there's a psychological element, almost a psychological healing that happens from removing that barrier, where people can really focus on the other things in their life that are important, and it really allows them to grow. And that for me is a very fulfilling aspect of what I do, that you don't really necessarily hear a lot about on TV or in the newspapers. Well, medicine, obviously there's a lot of years of training that go into becoming a practicing doctor. Medical school and residency and fellowship. So obviously, the basis is what you know from that training. So education is really important, but the practice of medicine evolves. It continues to move. There's always new technologies coming out, new drugs, new treatment strategies. So you have to pay attention and stay current, read the literature, go to your national meetings, sometimes read Vogue. And at the end of the day, all that information allows you to be a better doctor. You want to research the things, you want to make sure that they make sense, that they're safe for people, that they provide the outcome that they say they're going to. And I don't like to be the first guy on the block to adopt a new treatment. I like to make sure that it's sort of been vetted, and that it's safe, it does what it says it's supposed to do, and then I'm happy to bring it into my practice. So I think as long as you maintain you're paying attention, you maintain your education, you're thoughtful about things, then you can continue to evolve as a physician and really be able to offer the patients the best treatment option for their problem that's available.